Welcome. I have the pleasure of speaking again with Patrick Chen, Senior Director of Business Intelligence. Patrick specializes in development of innovative partnerships and leveraging advanced analytics for market intelligence, healthcare economics, and mergers and acquisitions. Thanks again, Patrick, for speaking with me today.
Thank you for having me.
So we've been discussing some of the common pitfalls and challenges when developing a data and analytics strategy. Now, I would like to discuss how does one go about measuring the success of that strategy? What would be the KPIs to measure?
Mm-hmm. Yeah. So that's a great question. It's one we ask really often when working in healthcare analytics. The mission of the organization, of course, is centered around patient care and improving patient outcomes. And so, our KPIs are actually extremely well aligned with business operations and our patient leadership team members. So the way we've structured it really is to focus on leveraging data to help drive those organizational KPIs, which is not any different than any other department, really. Instead, what we do we have major checkpoints in place to better understand how well positioned are we as a data analytics and strategy team in order to help our operation and clinical leadership members execute on their KPIs. And so if the organization succeeds, then in my opinion, the data strategy team is a part of that success. That doesn't mean that we don't have to plan ahead and have roadmaps in place. And the KPIs instead are more perhaps slightly qualitative in terms of do we have certain capabilities in place? But they're not necessarily like how many models did we develop this year? How quickly were those models developed? Those are definitely important considerations, but at the end of the day, what we're really looking to do is improve patient outcomes. And so our KPIs, just like our clinical team members, are going to be, how well did we treat our patients? What do their health outcomes look like? And then underlying between all of that is really just from an infrastructure perspective, how can we continue to do better? And so, KPIs in the traditional sense, I think are less common within healthcare data strategies. But instead, we focus on have we really supported our partners in, clinical service lines like cardiology, endocrinology, chronic disease management. Do they have all the data that they need in order to better serve our patients?
Yeah, certainly. I think the key component of the partners and integrating is so important, and measuring that as well. Mm-hmm. So as data experts, we are often excited and inundated with the amount of data coming in daily. There was a recent study which states 60% of organizations report that are not confident in their data and analytics insights, and only 10% said they excel in managing the quality of data and analytics. In your experience, has this veracity of data increased over time? If not, do you believe there's needs to be a renewed focus to increase quality and trust of that data?
Yeah, it's a fantastic question. I think it's coming up quite often within data executive leadership members. And so I think it boils down to a couple of things. One is that we are definitely getting better at all this. We have to be, right? Or we spend so much time doing it. One of the catches is that we're also asked to do much more complicated things on a more regular basis now. And so the accuracy of the final results, I'd say that we're continuing to play with that line of just how quickly can we develop items, how much interpretation do we leave up towards our clinical partners, and what do we rely on? And so the accuracy and the trust aspect of it is absolutely crucial, especially when these are used to make healthcare decisions and investments in populations. And so what we really focus on, especially there's two parts to it. One is from a population-based perspective, and the analytics that drive decisions on population health. And there's also the individual care aspect of it. So I'll start with the individual care aspect. And so especially here at Scripps Health, we really focus on partnering with our physicians. And that means that what we really do is we centralize information as concisely as possible, and then allow for that last mile to be delivered by the primary care physician. The reason being for that is that, there's definitely a lot of hype around, artificial intelligence models and end-to-end AI. And what that really looks like within the healthcare environment doesn't seem like it would really quite be as appropriate versus other industries. And so what my team and I focus on really is partnering with our medical directors and our clinical leadership members in order to really make sure that we're getting them as much information as possible, much like the interpretation of a lab result, much like the interpretation of an imaging exam. We focus on getting them to that last mile. And then we have a lot of faith in our clinical members, fantastic quality outcomes across the board, both on a, private and public level. And so we focus on that last mile delivery, getting that information to our doctors and our nurses and all of our clinical frontline staff so that they have, as much information to work with, and then allow them to really take care of those individual nuances.
So that at the last mile, I was just going to say it's so important, and I think the key focus in that area, is so important. So every organization and industry operates on independent factors that create differentiation among their strategies and executions. In regards to the healthcare industry, is it the strategy or the roadmap that is more challenging to execute? Do you think more organizations are getting the strategy correct, but failing to execute, or is it vice versa?
Yeah. So I think, as a leader within data and analytics, we chat quite a bit with others as well. And so I think there's actually a fair amount of standardization for the most part, up to maybe 3 avenues for roadmaps. And so I think the roadmaps themselves, they look pretty good. I don't disagree with most of them. In fact, a lot of them have been tailored, mildly towards organizational needs. But at the end of the day, I think it's the execution that can be far, far more complicated and nuanced. So the focus that we have there is really about how can we make sure that our decisions that we make and that the execution that's going on for the roadmaps are going to be a sustainable solution. I think we've all been there where we put a temporary fix into place because we know that there's a certain deadline to meet from an infrastructure perspective. But then there are some downstream effects. Then the data scientists and analysts are finding data integrity issues, nuances that they can't quite explain. And the only people that could explain is if we go back up the pipeline and start finding the data sets, back in their raw versions. This is where I think, execution can be, far more nuanced, and we can certainly chat about it for an hour really. But I think it boils down towards making sure that everyone's on the same page and then aligning that data strategy motivation across, leadership members to be the same really. People from different departments will, of course, have slightly different priorities in terms of what they need in the short term, while we're all definitely aligned in the long term. Making sure that those short-term priorities from a data strategy perspective are well aligned, I think will be extremely helpful. And what that really kind of boils down to is, do we want this, or do we want similar data sets? And do we want this, similar level of analytics for each one of those? This way we can kind of work and make incremental progress together, instead of everyone having, one person only wants clinical data sets, one team only wants financial data sets, and then you end up getting spread pretty thin. So I think making sure that, especially, at the director and VP level, that the data sets that they're asking for, and sometimes we'll, perhaps in an ad hoc format, that we have a sustainable solution in place and aren't just creating, temp tables left and right, views here and there, but instead we establish infrastructure that allows for a consolidated library, if you will, so that we can all pull from it. It's nice and organized. Everyone's on the same page. Everyone has the same definitions. Everyone uses the same flags. I think that execution is definitely where things get much more complicated, but it's something that we dedicate a lot of our attention to here.
Yeah, totally. I think establishing that, consolidated infrastructure, and also to your point of making sure the upstream, as best as we can, help simplify for the data scientists downstream is so important. And it's definitely the right things that you're all engaged in doing it. And there's a lot revolving around this. If I may ask, what do you believe is the best way to build that data-driven culture, in the long term?
That is a great question. And I won't pretend to have the answer for it, but I'm definitely happy to share what I believe in. And a lot of what I believe in is helping to make people's lives easier, and then being able to share what that impact looks like, from having data to what that looks like on a patient outcome level. I think it can be far easier to get buy-in across the board if you're doing things that help make the right thing the easiest thing to do. And so from a data perspective, what that can look like is making sure that the libraries and the schemas and the views that we develop are things that are useful for people, and we're not doing it just because it's on a roadmap that was developed a year ago. And so that requires us to be honest with ourselves and, pivot when necessary to revamp those roadmaps and kind of those guidelines. And whether or not they are OKR specific or whether or not they require, they're slotted for a specific requirement or outcome or goal within the organization. I think the most important thing is making sure that it makes our day-to-day lives easier, because a lot of the times, data is not replacing any of our work. It's just making us more efficient. And so if we can just make the day-to-day lives of our peers and colleagues a little bit easier, I think that buy-in is inevitable. People will love being able to do their job a little bit more efficiently and have more time for lattes and such. I think just being able to do that and translating those types of impacts towards patient outcome perspective, then now everyone's happy, right? Like now we see from a clinical outcome perspective, the numbers look fantastic. Patients are getting what they need. Patient satisfaction scores are great. Providers are happy with how they've been able to save time. Those are really important aspects and definitely can't be understated when fleshing out things like data culture and making sure we have buy-in across the board.
Yeah, I think you said it so well. I think we've seen a lot actually in terms of having it very centered around customer experiences or making whatever the customer may be, internal or external. And I think the point that you made is making their life easier, keeping that front and center and how it affects them is so vital. I think we're almost out of time, but I wanted to end on the topic of successful business transformation. Your approach to strategy development as a business intelligence leader. Can you talk about what would be a successful framework for a data and analytics strategy?
Yeah. I've seen quite a few good ones out there. And I think that the common theme across all of them is that they have some key components. I mean, this is a huge question, of course, right? Like, how do we be successful in implementing enterprise data and analytics strategies? The first thing that you usually start with, of course, is having your full executive leadership ready to go and being a part of this. That, of course, is very much the case over at Scripps Health. We have senior leadership members being a part of major decisions and also being able to share nuances for some of our, medium level decisions. Where I think this is, and then there's four main parts I'll jump into. First, of course, being the key executives and stakeholders, as physician leadership and C-suite and VPs. The next part of it is definitely data architecture. And this is where I think people spend the most amount of time. And there's a lot of analysis paralysis about what is the best product to use, what's the right software, where do we spend our next, 8-figure investment in terms of data and analytics capabilities, and also hire on the staff necessary to support that software. These are all major decisions. And I think, rightfully so, many people will pause there and kind of sit on it for a while. And then that's where implementation and execution can get a little bit delayed. But making proper decisions on, which data lake to have in place, what type of EDW do you want, what the reporting platform itself, and also what is your R&D environment when you want to jump into predictive modeling. I think those four components within data architecture are extremely important decisions to make. I will be the first to admit that there are constant new innovations happening within data software, and so there might be categories in there that really should be and maybe a standard in 3 years from now. But those are the four most common ones that I see between a data lake and EDW reporting platform, like a business intelligence platforms, and then an R&D environment. After that, the third part of the framework I think would be really important is data governance and your organizational structure for making those decisions. I see it most commonly, revealed as like steering committees and making decisions as to, which schema within the EMR do we bring over next? Which parts do we do next? Which one do we apply more standardization and normalization logic to? That really like kind of the in the weeds type of items. But as part of that, I think, governance is really important because it kind of drives, it really allows some autonomy for the data strategy team. This is where you oftentimes have the highest level of joint leadership on an operational level. So you'll have your directors and VPs, as well from an operational and business perspective, as well as your IT leaders. And from my perspective, also the business intelligence and pop health leaders. Everyone's sitting in the same room and they usually own their own, they own their service lines. And so being able to come to a consensus together about what their core strategies are and how they want to execute on those. I think it goes back to our earlier point of, how does that success look like, and being able to make sure that everyone is happy with the direction that we're headed into and not too many concessions are made, I think is extremely helpful. And you definitely don't want to leave out compliance as part of this data governance too. So within those committees, absolutely, please have your compliance members in there as well, especially if you work in healthcare and finance. We're extremely diligent about those types of items, and having your compliance member there in the early part of the conversation so that you're not investing a whole lot of time developing something that may not be compliant, I think is something that we all have top of mind for us. So we definitely pay a lot of attention towards that.
Yeah.
And then the fourth,
sorry, go ahead.
And the fourth category definitely is your implementation team, the people that really make it happen. And so that oftentimes is your informatics and your IT infrastructure team. The IT infrastructure, of course, will usually develop the backend items and all the tools needed for some of our more technical staff between the data scientists and engineers. Then, of course, it goes upstream towards the data architects. But after that, you also need to have plenty of infrastructure in place to help support your clinical informatics teams. And this is incredibly important for a number of reasons, but chief of which I think is making sure that the informatics team is able to implement some of these solutions in a way that your frontline staff are happy with. They are oftentimes, they are usually, the owners of the clinical workflows. And so it's really, really important to make sure that they are able to make the vision happen. And a tangential item towards that is also making sure that there is a process in place where if there is some research that you'd like to do and curate additional data sets, your informatics team being able to build in new data collection methods is paramount towards being able to do some R&D and see if there are obscure data sets that we have not traditionally analyzed. And perhaps they're an excellent classifier or stratifier for some of your predictive modeling components or retrospective studies, any of which are helpful. Sorry, Savio, you're mentioning?
No, I was just saying the consensus, bringing the consensus as well as the frontline teams and the compliance part. I mean, especially as you said, the healthcare industry. I mean, it's you're the entrant so deep into it. So I think all the four, the framework that you mentioned and the governance can be a separate topic in itself. But well said, well put. Thank you for sharing. All of those insights. I think that's about all the time that we have. I'd like to thank my guest, Patrick Chen, Senior Director of Business Intelligence. Thank you so much for your time, Patrick. Please visit cdomagazine.tech for additional interviews.
Thank you for having me. It's been a pleasure.